So students, now in this video we are going to study about evidence-based medicine. The topic of this video is evidence-based medicine. The definition of evidence-based medicine is that it is a process of systematically finding, evaluating and using research data into clinical decisions for better patient outcomes. It means that when we take a decision for a patient that which drug to be given, which drug to be stopped, then that decision will come from a research data, from a research that is being conducted with that drug on patients, and what that particular research says is going to be the basis of our treatment. And then why all this we are doing? It is because we want good patient outcomes. So in earlier times, the treatments were based on mainly experience. So we call as experience-based medicine, right? So the clinical decisions were made on the basis of experience, which was very subjective. That, okay, one doctor says that amoxicillin has treated this particular disease. Another doctor says, no, azithromycin is good. So then we use azithromycin. So earlier the treatment was experience-based, but now from that experience-based, we have shifted to evidence-based. Evidence-based as I told you earlier, that the treatment plan is guided by a scientifically credible evidence. So it is now becoming more and more objective, right? So this is the difference between experience-based and evidence-based, and this is what evidence-based medicine is all about. So today's physician should be capable of, doing certain things. He should be capable of finding, researching, finding the data, then, applying the appropriate results. What is the data that we need to look for? The data that we need to look for is, first of all, the benefit from the drug. That from the drug, how much benefit has been taken, and that is usually quantitative. It is not qualitative. Quantitatively, what benefit the drug has given. The second thing is that from the data, then we also take the dosage form. In what dosage form the drug was given, the duration for which the drug was given, the patient selection, which patients were taken in the study, right? The third thing is comparison with other existing treatment. So what it means is that in comparison to other treatment, how more beneficial it is and how safe it is. So what are the adverse effects due to that particular drug? So if the drug is more efficacious, if the drug is safe, and if the dosage form and the route of administration and duration is good, then that particular medicine will be selected. Then now, what are the clinical studies that usually are studied? So clinical studies, we divide them into three types. The first one is clinical trials. Then we have cohort studies, and we have case control studies. So in this, I'll just give you a brief detail. I'll not go into very much detail because that is not your level. So we'll try to understand these three terms in easy language, right? So the first part is, what is a clinical trial? Let's try to understand a clinical trial. So a clinical trial is defined as, it is a prospective, ethically designed investigation in human subjects to objectively verify or compare or find the results of two or more therapeutic measures. Here the measures we are talking about are drugs. So understand this definition. Each and every word carries a lot of meaning. First of all, prospective. Prospective means it is always in future. A thing which is, retrospectively, it is not a clinical trial. Ethically, the clinical trial is bound by the ethical principles. Design investigation in human subjects. So we are doing clinical trials in human beings. Animal studies are not called as clinical trials. To objectively as in, so that the data is collected in a very objective pattern. The data is collected either through the investigations which are done right? It is not based on patients' views. Then to verify or to compare or to find the results of 2 or more therapeutic measures. So here the measures that we are talking about are drugs, right? Now another word that comes in them is, first it is called as, clinical trials are usually have got certain names. So the first name that comes is, the first thing that comes in their name is controlled. So controlled means there is a control group. So that means what? कि एक clinical trial है, एक test है, जिसमें there are 2 arms. One is the test arm and one is the control arm. The test arm is given the drug which we are going to investigate, and the control arm is given a substance, inert substance, which is called as placebo, or maybe an existing approved standard treatment, right? So why this is done? So that the effect of drug in this group is very well compared with a control group who is receiving an inert substance or an existing substance. So this way we are able to compare the effect of the test drug, right? So this is called as controlled. Now the design in this can be either a parallel group design, or it can be a crossover. So parallel group means the test group and the control group are running simultaneously. They are being given drugs together. While in crossover, first the test group is given the test group is given the test drug, then it is given the placebo, right? And here the placebo group is first given placebo, and then it crosses over and it also takes the test drug. So in the same subjects, they serve as their own controls also, right? So this is the design, and this is how a clinical trial is done. Another terminology that is used in clinical trials is basically randomization. Now let us understand what is randomization. So what happens in randomization is that the subjects are selected by a random table or a computer program. So that, why this is done? Now why randomization is done? Why it is done? Because we want to remove the bias from the study. So any type of bias kaise? Ki the study investigator will say, okay, I like this patient, he is perfectly well suited for my study, so I'll take him into the test group, or I don't like this patient, so I'll put him in the control group. So this is bias. Here now the bias, to remove that bias, we select patients based on a random table, like chit system, कि आप chit रख दिया अपने सामने, and then you ask the patient to pick up that chit, and whichever chit he picks up, he becomes a part of that group. So what will be ensured by randomization? That equal chance of being assigned any group, right? So there's a 50-50% chance that he may go into a study group, a test group, or he may go into a control group, right? Now another randomization can also be stratified. Stratified randomization bhi kara ja sakta hai according to the age or their gender or their disease severity, like it is mild, moderate, severe. So more stratification in the randomization can be done. Now another way of reducing the bias is blinding. Now what is blinding? There is something called as single blind, and there is something called as double blind. Now blinding means that concealment of the nature of drug. So concealment of the treatment, of the test or control, that is treatment part, is if the patient or the subject is not knowing about whether he is getting a drug, test drug, or a placebo, then it is called as a single blind. And double blind, if along with the subject, the investigator, the person who is conducting the trial also doesn't know whether the patient is being given a test drug or a control drug, then it is called as a double blind. Here basically they are given treatment in similar looking packets. So they are basically similar in looks, number, weight. The drugs are prepared in such a way that they look very similar, and the packets are unlabeled, right? So this way nobody comes to know that what the patient is receiving. And this blinding, this concealment is basically managed by a third party, right? And this code is broken at the completion of the trial, and then the results are analyzed. Now trials in which there is no blinding, they are called as open trials. So this is another process of ensuring the removal of bias. So what are the best trials? Best trials are those which are randomized, controlled, and double blind trials, which are also called as RCT, randomized controlled trials. They are the most credible. They are the most credible method of obtaining evidence of efficacy, safety, and comparative value of the trials, right? Then we have something called as meta-analysis. Now meta-analysis means what? Meta-analysis means data from several randomized controlled trials is pooled together to bring out the overall balance of evidence, right? So suppose there are 50 trials, 50 RCTs are done on one particular topic, so they all are pooled together, and then that data is understood objectively, and objectively it is understood and analyzed, and that will help in giving us a final, that will help us in giving a final piece of evidence that okay, all these studies are saying so this is the treatment, or this is the way in which we should proceed with the treatment, right? Now coming to the third, what is a cohort? Cohort study करी जाती है. Cohort क्या होता है? Basically cohort studies are observational studies, right? So इसमें observe किया जाता है any effect, side effect that has come in response to the drug. Cohort is basically a group of individuals with similar type of characteristics, with similar features. So a cohort is made, and then the cohort is given a drug, and then they are followed up. Now cohort studies can be prospective. So prospective as in they are forward, and they can be also retrospective. Retrospective as in that is backward. So what is done? It is very simple. Patients, the cohort is given the medicine. In prospective study, the result is seen, followed up. So how do you do it? You follow up the patient. You see whatever side effects have come to that particular drug or not. And what is done in retrospective study? The data is analyzed. So we just go to the MRD and we analyze the data, and we see whether the particular treatment had a beneficial or a harmful effect, right? So this is a cohort study. Now what is case control study? Basically these are also observational studies, and the main design pattern is basically a suspected adverse drug reaction with a particular drug. So with this hypothesis that a particular drug has caused a ADR, the cases are collected, and by going back in time, all the hospital records, disease registries are done. Then one control group is also created, which is taking the drug but not having the adverse effect. For example, there was a drug, say nimesulide. This was a painkiller. This drug was given to people for pain. So nimesulide caused liver injury, and this particular side effect was seen in a particular group, and there were patients who took nimesulide and there was no liver injury, right? So now to study whether this liver injury in the patients was due to nimesulide, a case control study is done in which both the groups are compared, and then finally on the basis of all the data, this is all the data which is received, on the basis of all data analysis, then it was proved that nimesulide is responsible for liver injury, and when this data came forward, then it was banned. This drug was banned in small children and then further in adults also. So this is how a study gives a result which helps us in making treatments better for the patient. So coming to the topic that we started, that is evidence-based medicine. I have given you a brief detail about what all types of studies are there, and then how they can be studied, and how evidence on the basis of the available scientific information the doctor takes the decision of making a treatment plan. Now usually इसमें ना एक pyramid होता है. There's a pyramid that you need to understand, and let us understand this pyramid. On the base of the pyramid is the first thing that we have is the or it is also called as the hierarchical pyramid of EBM, because on the basis of this pyramid is explaining that which is the best way to find out the evidence or reliability. You can say reliability, right? So at the bottom we have animal studies. Animal studies are least reliable. I mean, we cannot depend upon the animal studies for giving the treatment in human beings. Then the second level that we have are case reports or case series. This is again less reliable. The third that we have is case control studies, which is usually retrospective from the hospital registries, right? Now this is what we call as less reliable. I'll say this is given as level 1. Then case control studies, and we also have cohort studies. Now these two, they come in level 2 of reliability. Cohort studies, case control studies are level 2. Then next we have clinical trials, right? So clinical trials can be randomized controlled trials, open label also. They can be blinded, they can be single center, or they can be multi-center, right? So the case control studies, clinical trials can be of any level. So this comes as the level 3. उसके ऊपर चलेंगे तो now after case control studies we have what we call as meta-analysis, or after that we have systematic reviews, right? And then we have books based on that. So these together, then they make level 4 of the reliability. So सबसे bottom पे animal studies, case reports and series are least reliable, case control cohort studies more reliable, clinical trials at the third level, and the most reliable are meta-analysis, systematic reviews, and the books, right? So this is the hierarchy of reliability of the scientific data in using in clinical practice.